Hi everyone, welcome to the YouTube channel FMGE Dr. Man. In this video, actually, I'm going to share this miscellaneous topic, which is not frequently asked, but so many times, lots and lots of one-liner type of questions may arise from here. So, to solve the one-liner type of questions and lots of image-based questions asked from these topics, so I had just given name the miscellaneous. So we'll see the topics like oral cancer. We'll see. I mean the top. I mean the all the topics from the oral cavity. We will see the salivary gland topic. We will see the some skin cancers topic. So because it is not the very lengthy, it is very small. I mean, in very small topics, and we have to know only the superficials. Very few things we have to actually know. So uh, this might help you, to just gain maybe sometime 1 or 2 marks in your examination. And these are the all topics. I mean, such kind of questions are asked that you are 100% confident that, okay, this is going to be the answer of these questions. There are no confusion, nothing at all. So this is short 1 marks type of questions. I mean the one liners or image based questions, lots and lots of time. It has been already asked even when you will solve the EMS paper or NEET PG paper. You may see lots and lots of image based questions from this topic. So let's start the first from the oral cavity. Okay, so oral cavity, they would like you the I mean they would like to ask first about the three things. I mean the two things, erythroplakia and leukoplakia, and third is the, of course, candidiasis. So you have to know these three things: erythroplakia, leukoplakia, and candidiasis. And you must be able to differentiate between I mean the among all these three. And you must be you must be able to identify on the image based questions as well all three conditions. So so read about the erythroplakia, leukoplakia, and candidiasis. Okay, then of course they so many times they ask about the risk factor of oral cancer. So look at the risk factor of oral cancer. So many times they have already asked about the oral cancer risk factor. Um, if you talk about the just one things in the oral cancer, read about the risk factors of oral cancer. And then you have to know about the oral mucosal fibrosis. Which is caused by the betel nut, which is known as the supari in our country. So you have to know about the oral mucosal fibrosis. Okay, they might give you the image based question as well, and they will ask the treatment about the oral mucosal fibrosis, because this is very lots and lots of cases in our India. So they ask so many times oral mucosal fibrosis. Okay. Then as we move ahead, they so many times ask about the Plummer-Vinson syndrome. Plummer-Vinson syndrome, it is related to the anemia, and lots and lots of feature of anemia, and this is the integrated from even the medicine part of the medicine part as well. So this is what the combo of surgery and the medicine part. So read about the Plummer-Vinson syndrome, and there are so many synonyms of this syndrome. So read about that as well, because so many times they just replace the Plummer-Vinson syndrome and they might give you the another name. So watch upon that as well. And next thing you have to know in the oral cancer, they will ask the mainly the 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 treatment of this. The surgical treatment. And in surgical treatment of the oral cancer, there are mainly flaps. Okay, so as we have seen in the plastic surgery chapter, so you have to know about the some flaps, which is basically the specialized for the oral cancer, especially about the lip surgery. Okay, like we have the ABS slender flap. Okay, so read about the ABS slender flap. Even previous FMGE paper, it was already asked. So read about the ABS slender flap. Okay, read about the commando flap. Okay, deltopectoral flap, you have to know. So read about all these three flap and their arteries. Okay, so this was all about the oral topics. Very small, very less question asked. So many times just one liners or image based questions. So you have to know about all these three all these topics whatever I said. And as you move ahead in the salivary gland, it is much more yield topic and frequently asked. So first you have to know in the about the salivary gland, about the ranula. Ranula image based question has so many times asked about already, ranula. Okay, ranula and plunging ranula, you have to know all these two I mean the all I mean these two topics, and read about and see the image based as well of ranula. Okay, then if you talk about the parotid gland, parotid gland is you're going to be the most priority, because every time they ask only from this gland. Okay, so you have to know about the pleomorphic adenoma and Warthin's tumor. These two tumors you have to know, and there are lots and lots of one-liners. Mainly one-liner they ask like what is the most common tumor of parotid gland? What is the most common overall tumor of salivary gland? Okay, what is the most common tumor of minor salivary gland, major salivary gland? So they will ask you the one-liner type of question from the salivary gland. And two tumors, pleomorphic adenoma and Warthin tumors, you have to know about the salivary gland. Then in the salivary gland, you have to know about the parotid abscess. Okay, parotid abscess image based question they will give you, and they might ask you the treatment part, and some clinical correlation with the mumps. So read about mumps as well for the parotid gland. Okay, so this was all about the salivary gland. and okay, and as we move ahead, we have to know very few things in the skin cancer. So first you have to know about the dermoid tumor. Okay, dermoid tumor you have to know. You have to know about the malignant melanoma in the skin cancer chapter. Malignant melanoma is you may read in the eudermat as well, so read in the little bit depth. Okay, all the classification we have, you have the Clark and Burslow classification of malignant melanoma. Even they might ask that, so read about malignant melanoma in little bit depth. Okay, then you have to know about the basal cell carcinoma of skin. This is very frequently asked, very frequently asked. You have to know just one cancer of skin, read about the basal cell cancers. 90% chance that you will get one question from basal cell carcinoma, either in your dermat section or in your medicine section or in your surgery section. 100%. And second thing is the squamous cell carcinoma. Okay, so you have to know about the malignant melanoma, basal cell carcinoma, and the squamous cell carcinoma as far as the your skin cancer is concerned. So read about these three skin cancers. And so this was the the miscellaneous topic for the surgery. And one more thing I would like to share about the neck dissection. When you read the oral cavity surgery, you may find the types of neck dissection. There are three types of neck dissection. Okay, the modified radical neck dissection. So they will ask you what is the type 1, what is type 2, and what is type 3. What kind of structure we will preserve in the type 1, what kind of structure we will preserve in the type 2, and same for the type 3 as well. So read about the modified radical neck node dissection, MRND. Okay, so this was all about the the miscellaneous topics of oral cavity and salivary gland, and of course your skin cancer. So these are the miscellaneous. And we have just left one more videos. I think it will take about uh, the vascular surgery. Vascular surgery is very frequently asked, of course, and it is quite higher than miscellaneous. So um, we will just make one more video about vascular surgery, and I think we will end up with the surgery, the whole surgery. So thank you guys, we will meet in the next video.